are going to see about infertility and yoga, because nowadays the biggest problem in the world is infertility. What is infertility? Infertility is a failure to conceive within 2 years of unprotected sex, and this is due to changing lifestyle, increased use of contraceptives, and exposure to toxins. This link to infertility. Usually 40% due to female and 40% due to male, and 20% is unknown. In infertility, the 15% of couples is suffering from this problem. That is 1 in 6, the ratio. The infertility can be more stressful in female because all the family members and friends is always asking about pregnancy, and this problem occurs, and this is very bad effect give to that lady, then the divorce or the loss of parents. A male infertility is not depend on only the quantity and quality of sperm, but is also depend on motility of that sperm, then the poor quantity of that sperm, ejection is also important, difficult to, and this all these things is very difficult to success the pregnancy. In about 40% of infertile couples, the male parents is the sole cause or it the contributing cause of infertility. Still, many times the society always blame to the female also, and the treatment is going on for only female. That time, same, we must want to investigate the male if any problem in the ejection or in the sperm, the quantity, quality, motility. Now see the causes of male infertility. The sperm productions problem. First is the chromosomal or genetic cause. In this, the lifestyle, the diet, and some yoga is helpful. Undescended testes, no use of yoga because the testes change her area, means the testes in inguinal region or in the lower abdominal area from birth, and for this the operation is the only remedy, a small operation, and if you do the operation before puberty, then it's helpful. For infection, again yoga is good because many time the frequency of infection is more, then the patient is taking antibiotics all the time, but yoga will reduce the frequency of infection, and therefore the patient will take antibiotic also one or twice in a year, and then It is helpful to increase the sperm count. Torsion, again the twisting of the testes in scrotum. Then varicocele, for varicocele, the naturopathy treatment, some yoga is also better. There is a like varicose veins. You can see the varicose veins on the scrotum. This is also reduce the sperm count. Then medicines and chemicals. If the patient is taking any medicine, then the side effect is there. The sperm count is less. In this, yoga is again good to reduce the side effects of medicines or chemicals. Radiation also damages the testes, the work of testes. And for unknown cause, yoga is best, because when there is no any cause, then yoga is best. But if the sperm count is zero, then yoga is helpless. Blockage of sperm transport. Yoga is useful. Then infection, again yoga is good to increase the immunity power of that man. Prostate related problem, if the prostatitis is there or any other problem in first stage, yoga treatment is best. Absence of vast difference, there is no any treatment for there, no use of yoga also. Vasectomy, it's a permanent infertility, or what you say, it is a permanent contraceptive, vasectomy. And in that person also, infertility is there. Other cause of male infertility is sexual problems, that is erections and ejaculations problems, retrograde and premature ejaculation, failure of ejaculation, erectile dysfunction, infrequent intercourse. In all this thing, all this problem, the yoga is very important. But in spinal cord injury, then yoga is not the treatment for spinal cord injury, or while doing prostate surgery, any nerves is get injured, then also the infertility occur. Damage to nerve or some medicines, if the side effect of some medicines is there, then yoga or the lifestyle is helpful. The cause is again hormonal problems, same in female also. If the pituitary tumor is there, then the follicular stimulating hormones and luteinizing hormones is not secret properly, and therefore again the infertility is there. Then pituitary problem from birth is there. Then hormonal imbalance, anabolic, that is androgenic, because of steroids. Then vasectomy is there, injury of or infection of epididymis. In this, yoga is not useful, but in again unknown causes there of infertility, the yoga is helpful. Hormonal imbalance is there, the yoga is good for increase or release the FSH or LH. Stress is the main cause of all problem. Therefore, many diseases psychosomatic. Because of stress, the stress is occurring hypothalamus. And hypothalamus secrete that gonadotrophic stimulating hormones, which stimulate the pituitary. And pituitary secretes the follicular stimulating and luteinizing hormones, which again stimulates the adrenaline and stimulate the testes. If there is a stress, then the hypothalamus is disturbed, and so the follicular stimulating hormones, stimulating hormone, then luteinizing hormone, all these things are imbalanced. And so many time only doing relaxation, the conception is occur. We have seen many couples come in our center for at least 10 days. We give some relaxation techniques, meditation, onkar chanting, yoga nidra. After doing all these things, within 6 months, they have get the result. That is, a conception is there because of only relaxation. Mostly in the unknown cause and hormonal imbalance, the yoga is best. Study of Harvard University that women have infertility is more because of stress, depression, anxiety, and it is equivalent to the cases of cancer and HIV/AIDS positive. Even women without infertility problem can be find trying to have a baby, a mysterious process ultimately beyond our control. The anxiety and the stress is the main cause in the female. Because of anxiety, the hormonal imbalance is there, and the root cause is again hypothalamus and pituitary, and so the FSH, LH, all these are imbalanced. The adrenaline secretion is there, and therefore the anxiety is more. In this case, the body temperature of also increased, and so the infertility is more in this female, those who are very anxious or those who are very nervous. And this is because of many time the stress. If the stress is reduced by doing giving yoga, meditation, if we reduce the stress, automatically the anxiety will be reduced, the stress will be reduced, the body temperature also become normal, and the chances of conception is more in that lady. In 2000, Domar found that 55% of infertility patients becomes pregnant without taking any treatment, only doing yoga. And we also know because many patients come to our Gurukul, those have no child, no conception since 1 years, 2 years, or 5 years. After giving yoga therapy, we get the best result. Those who are mm, infertile because of anger, because of uh, depression, anxiousness, because of hormonal imbalance. In these cases, the yoga therapy is the best and we get the result within 1 year. But in this, the couple must come for at least 20 days in our Gurukul for taking treatment, and the result is best. Hypogonadism is occur due to less secretion of hormones like FSH or LH, or because of undescended testes in male, hypothyroidism, and result is infertility. In this case, the IVF or IUI is the treatment, and IVF is very costly. IUI is cheap, but result is not 100% in this both treatment. Most of the women have children when they are above 30 nowadays, and because of that, after age of 30, the mature egg is less. They release the egg is very less in number, and therefore the infertility is there. The age after 30 or 35, there is a problem of infertility in the woman. Ectopic pregnancy is the pregnancy which the embryo gets implant in the fallopian tubes, or uh, in the pelvic cavity. The 37% of women has women who have ectopic pregnancy, and the cause of the ectopic pregnancy is smoking of low quality of cigarette, then because of sexual transmitted disease, then using the intrauterine devices, then contraceptive pills, having the inflammation or endometriosis are the reason, and therefore the ectopic pregnancies. And fibroid is very common in women. It is not harmful, uh, but when it's started bleeding or bloating is there, bloating of abdomen is there, or if give the pressure on the other organs, if it is really more large, then we want to remove the fibroid. Many times the pregnancies also occur with the fibroid, and the fibroid become go press by the baby. But if the pressure come on the baby, then the some abnormalities occurs in that baby. That is not good thing. Again, the it can cause early miscarriage also many time, and the birth deformities also occur because of the pressure of that fibroid occur on the baby. PCOD is a polycystic ovarian disease. In India, more than 1 million females are suffering from PCOD each year. Every year, there are the rate is going on increasing because of the food and no exercise. The polycystic ovarian disease means the pituitary release the FSH, that is follicular stimulating hormones, which stimulates the ovary, and the egg come out from the ovary, and which secretes the estrogen, and the covering is not rupture, and that egg not come out, and the liquid is around that fluid is around that egg, and that egg is look like grapes, and many small grapes are there, looking like grapes, the bunch of grapes which attach to that ovary is a polycystic ovarian disease. Many small mm, egg with fluid is attached, and this occurs in fertility. Endometriosis, this is the inner lining of the uterus, that is a endometrium, which is grow outside the uterine cavity, and because of this there is a heavy bleeding, then more pain during menstruation, and the period is mostly 15-20 days, and there is a no actually treatment. The treatment is to stop the bleeding, otherwise to remove the uterus, and it also affects the pregnancy, and also it affects the fallopian tube, and it causes infertility because of the progesterone level is not uh, proper, that progesterone level is low, and therefore the infertility is there. PID, or pelvic inflammatory disease, this is a cause of sexual transmitted disease like gonorrhea. If this diseases occur, it affect on the cervix and vagina and the reproductive organs, and which is the one of the cause of miscarriage and ectopic pregnancy. In first stage, if we detect it, then we can treat it with the medicine. uh, when the this disease go through the other organs, or all the other pelvic organs, then the infertilities or miscarriages there. To prevent this sexual transmitted diseases, we want to use the contraceptives and while doing sex, and avoid the multiple sex partners. Then we can protect, uh, we can protect the sex organs with from infection, and this is one cause of infertility. Pelvic and abdominal surgery. The surgery is done to remove the gallbladder stones or scar tissues, pelvic adhesions, and treat the irritable bowel syndrome, often interferes with the infertility. Pelvic adhesions are fibroid tissues or scar that grows around the fallopian tube, uterus, and bowel. This mainly cause the form the endometriosis, which ruptured the appendicitis, and pelvic inflammation disease. The pelvic adhesions prevent the fallopian tube from collections the eggs, and this is one of the cause of infertility. The age in between 36 to 40 is premenopausal year, and in this the egg releasing is become less, and because of this the cycle is also reduced. That actually the normal cycle is of 28 days. Here the overlapping of the cycle is there of 28 days. And the uh, because of this the ovulation take place at the 7th or 8th day. And so the inner lining of the endometrium become thinner and thinner, and so the implantation is very difficult uh, here, and the infertility is there. Premature ovarian failure, early onset of the menopause before the age of 40. In this all the hormones is become disturbed. The FSH, LH, uh, estrogen, progesterone, they all are in low level. And also there is no menses at least 6 months, and 6 months, 4 months, and the egg is not releasing. And this is one of the cause of infertility. And so the woman cannot conceive. Tubal disease, damaged or blocked fallopian tubes, which prevents the egg from reaching the uterus and sperm from reaching the egg. Many times this occurs because of hormonal imbalance also. The some pituitary hormones like oxytocin is not releasing well, then it occur. But there is no blockage in the tube. But if there is any blockage in fallopian tube or any damage, then again the conception is very difficult. Therefore the laparoscopy surgery is there, or IVF is there. But this is because of only hormonal imbalance and no blockage in the fallopian tube or no damage in the tube. Then the yoga is very helpful in this condition to meet the sperm to that egg. The proper function of the thyroid gland is important as it affects all organs of the body, especially the menstrual cycle. Hypothyroidism or hyperthyroidism is bad as it speed up and slow down the body process. And this T3 and T4 is the secretion of thyroid, which stimulated by the thyroid stimulating hormone, which released by the pituitary gland. And again this is disturbed due to stress. If any stress is there, then TSH is unbalanced, and therefore the hypothyroidism or hyperthyroidism occurs. And this is a main role of thyroid in the health of baby and mother during pregnancy. But after taking medications, we can avoid the harm of the baby and mom. The other problem conceiving may be due to stress. Because of the stress, again the TSH problem is there, then hormonal imbalance is there, and this is the biggest problem nowadays. And the only treatment is yoga therapy. Again the anxiety is also same because of tension, the adrenaline secretion, frequently secretion of adrenaline. Again because of anxiety the acidity and heat increased and infertility is there. Obesity is the main problem for infertility. and because of obesity there is a PCOD and hormonal imbalance and weakness of genital organs, PCOD, like these problems occur. Lifestyle is disturbed, then the again hormonal imbalance is there. This if the woman is not going to sleep early, because the first 3 hours is very important for normal hormonal secretions at 9 to 12 at night. Therefore, early to bed and taking proper food, the proper diet and proper time of diet and healthy food, that is we say the sattvic or yogic diet is very important, that lunch at up to 12 o'clock and dinner up to 7:30 is very important. Any disturbed relationship, again it's occur its effects on the infertility. Hormonal imbalance, physical and emotional problems. It's imbalance the hormones of FSH or LH, testosterone in both male and female. If there is any weakness in the pelvic region, the weakness of uterus, weakness of fallopian tube or blockage of fallopian tube, because of weakness of uterus, the frequent abortion is there, threatened abortion is there. And again, asanas is very important here to increase the muscular strength of the uterus. Then low prana or low vitality will be increased due to doing the meditation and omkar chanting and some yogic processes. Then relationship with menstrual cycle, lack of awareness. Many time they don't know at which is the proper time for intercourse and also for conception, when the fertility is there. They don't know the proper guidance of or the proper knowledge of the fertile day. Any toxicity of metal or any chemicals is also harmful. Then drugs, any drugs they are taking for long time for any chronic disease, the infertility will be there. And low immunity, because of the infection is always occurring for frequency of infection is more, mostly the pelvic infection, or the immunity power is not there, then any infection is there, always the lady or that male is sick, then also infertility will be occur. Now we will see what kind of yoga is helpful in infertility. The traditional yoga and restorative yoga. That is, restorative is the using probes like blanket or pillows and like this, and doing yoga is very useful in infertility. Hatha yoga is also considered to be very ideal for infertility, which uh, circulate the whole body, blood circulation will be there. Then the asanas is very slowly and stay in particular asanas, and slow movements is there. And because the breath also slow in while doing the asanas, and because of steady in particular asanas, and when the mind is calm and quiet, because of the breath is slow, and then only the particular lady or that man focused on their problems, mostly the genital organs, while holding the particular asanas, they have imagined that the mind, that is the vital energy is coming, and the flow is into the genital areas whole over the body. The flow of vital energy is more, and this is again very effective for conception and to remove the infertility. This productive mind associations triggers the feeling of well-being and energy to the affected areas. Yoga for men. In these asanas, which creates stretching, compression, twisting of the lower abdomen, and that is Matsyasan, Bhujangasana, Shalabhasan, Ardha These are the asanas which twist and stretch the lower abdomen. Asanas which have effects on the pituitary gland is like Shirshasana, then the Surya Namaskar, that sun salutation is fifth pose of sun salutation, then shoulder stand. These are which stimulate the pituitary and which affects on the pituitary. The inversions are the especially helpful in for the blood circulation, good blood circulation of testes and prostate and the genital organs, and also to increase the strength of that muscles organ. In pranayama, the relaxation and cooling pranayamas is good in infertility, both male and female. That Ujjayi pranayam and Brahmari pranayam and Shitali pranayam is cooling pranayam. Then Brahmari is for calm and quiet the mind, and Ujjayi is good for the hormonal imbalance, mostly the thyroid. Then Udyan Banda, Agnisar, and Mool Bandas. These bandas are again effective to increase the strength of the genital organs. Uh, so the Agnisar is 100 times. You should give the strokes, and Moola Bandha and Udyan Bandha is also on their depend on their capacity. Then Shanmukhi Mudra is also important. Onkar chanting again important to calm and quiet of the mind, and also to reduce the stress, and it also the vibration of the Onkar chanting is stimulates all over the body of all cells in the brain, cells, and also the genital cells which stimulates, and the circulation is also good because of the chanting Omkar, and the vital energy will be increased. Yog Nidra is good to remove the stress. That stress related Yog Nidra is there, which reduce the stress, and also the positivity. Many times the 2 years there is no child, therefore the male or female is always in stress, always thinking about that, and to remove this negativity the Yoga Nidra is the best. And so the Yoga Nidra they should do twice a day. If the infertility is there, the male or female, then the both of them should do the yogasanas and pranayamas and cleansing process and bandhas, mudras, meditation, mantras, and they must change their lifestyle and diet. Not only the single male or single female should do this one. Both of them, if they do for at least 3 to 6 months, then the result is there. They conceive within 6 months. Doing yoga practice, both of them is very important in infertility because it reduces the stress and anxiety of both of them, because they both are involved. It also balance the emotions, and mostly the guilty feeling is there, or anger, fear, frustrations, they remove. Also, the after doing yoga, the all the hormonal imbalance is there, then it will be balanced. Then it increase the strength of pelvic organs, especially the uterus or the ligaments of the uterus and all genital organs. Because of the weakness of the muscles, many times the abortions occur. And then it also correct the position of the uterus, because the uterus is the normal position is introverted. If it is retroverted, then again the problems occurs. By doing some asanas and bandhas and mudras, it will be in the correct position. uh, Also, both of them know the yogic lifestyle and yogic routine for conception. uh, it also increases awareness of the body and mind, especially in the relation of the menstrual cycle. They know the important things, or many uh, uh, important things when they want to conceive, after how many months, and which is the proper day and which is the proper position, and all knowledge both of them must know. And therefore both of them should do the yoga, or they must do the yogic therapy, yoga therapy. Chakra meditation is good. Again, both of them in this, the Agnya chakra, which balanced whole the body. The Agnya chakra is again important to affect it, if you do in on the meditation on the Agnya chakra. It's the two petals and ash color chakras. Imagine on the in between the both eyebrows. If you chant the Om mantras and do the meditation on them, the effects is it affects on the pituitary gland. Then Vishuddhi chakra is near the throat. The mantra is Om Hum, and it is good for voice and expressions. Then Anahat chakra, imagine it is near our heart, at the spinal cord, near the spinal cord. The area is near heart, and it is good for emotional expressions. And the mantras is Om Yam. Yam is the mantra. Then Manipur chakra in the umbilical, uh, on the spinal cord near umbilical, and the mantra is Om Ram. Om Ram improves the balance, energy and prana is affects. And it also affects on the adrenaline gland, which secretes the adrenaline, which increase the stress. Then Swadhisthana chakra is Swadhisthana chakra and Muladhara chakra is very important in reproductive system, because uh, they are situated at the end of the spinal cord. And the Swadhisthana chakra is there, and Muladhara chakra is in between the anus and genital organs, and both of them are uh, control on the all the genital organs, that is the bladder, fallopian tube in male, that is the testes, and also the penis in female, the vagina and ovaries. And so the um, chakra meditation is very important in both of them. uh, in this, the Muladhara chakra and Swadhisthana chakra, they should do the meditation for longer time than the other chakras. If there is a hormonal imbalance, then the thyroid problem is there, then the Vishuddhi chakra, they should concentrate more if the pituitary problem is there, that FSH, then the concentration on the Ajna Chakra is more. While doing the asanas, it will increase the strength of reproductive organs, then the ligaments, and also it increase the pranic energy. Then it balance the hormones of thyroid or pituitary or adrenaline, and also it improves the blood circulation, and it will increase the strength of the muscles. It remove all the toxins. It balance the mind also. The mind will be calm and quiet because of doing asanas, and it is very important because in the while in the conception, all these things are normal because yoga is a process of normalization, and this the asanas will be helpful in doing the body normal. While doing the asanas, the Sarvangasana or Viparit Karni or the shoulder stand, this asanas is good to secrete the uh, FSH, LH, which secretes by the pituitary. The pituitary secretion will be normal. Then also it reduces the stress, and also it good for the circulation. Then Naukasana in the supine position, which increase the strength of ligament around the uterus, and it while doing the Naukasana, it pull the all the genital organs little bit upper side, and therefore the ligament and tendon will be strong, and the uterus or the male genital also will be strong. In chakrasan, affects on the hormonal secretions against the adrenaline secretion, thyroid secretion will be normal. In shirshasana, the pituitary gland is affected, and it's the normal secretion will be occur after doing the shirshasana. Bhujangasana is good to for balancing the reproductive organs and reproductive secretions. Again, the Ardha Matsyendrasana is good to relieve the congestion in the pelvic region. Titlyasana is good in to open the pelvic region. Also, it is good in the blockage of fallopian tube. Halasan is good for all the hormonal imbalance, mostly the thyroid. That T3, T4 is low or more, that hypo or hyperthyroidism. Then also to it's good for pituitary hormones if the FSH or LH is not secreting well. Then do the halasan, which again it's give the pressure to the pelvic region. Therefore, the blood circulation will be good after doing halasan. Then Kandarasan is a very important asan. Also, you said that Setu Bandhasan. It increases the tone of the pelvic organs. It prevents miscarriages, menstrual problems, and it's good for prolapse. In the first degree of prolapse, it is good to increase the strength of the ligaments of the uh, uterus. Then Matsyasana is good again to increase the prana of the that male or female in the pelvic region. Then Shalbhasana is good to increase the strength of the pelvic organs, and it also the automatic Sahajoli mudra will be there after while doing the Shalabhasan. Then Dhanurasan is good again for the hormonal imbalance, and it regulates the periods, and because of the stretching of the whole abdomen region, It's good in the menopausal symptoms also. Paschimottanasana is relaxed and give the compression on the pelvic organs. Also, while doing Paschimottanasana, there is some pressure on the thyroid and stretching of the pituitary. The hormone. It's good also for hormonal imbalance. Then Supta Vajrasana or Vajra Matsyasana is again good. It gives the pressure to the pelvic region, which remove the congestion, and also it good on give the stretching of the thyroid. And Ustrasana is also same. It stretch the thyroid region, and it good for thyroid, and give the pressure on the pituitary, that to thyroid and pituitary, any hormonal imbalance is there, then this asana is good. And it tone and give the strength of the pelvic region. Other many asanas are there which balanced, that is Ardha Chakrasana is there, Uttan Pad Chakrasan, then Ashwini Mudra. Ashwini Mudra again is good for the female, which increase the blood circulation in the pelvic organ, and also remove the congestion, and give the normal position to the uterus. If the blockage of the fallopian tube is there, it removes the blockages. Then Akarna Dhanurasan is also good, which open the pelvic region properly, and remove the congestion. Then Sankatasana, Garudasan. Garudasan is good for the PCOD problem is there, or any congestion in the uh, fallopian tube. Then Parivarta Trikonasana, which twist the pelvic region, and good to increase the energy and increase the strength of the pelvic organs. Virasana, which give the increase the strength of the muscles of abdomen and pelvic region. Uttan Padasana, then Patangasan, Siddhasan. The Patangasan again is good to balance the body. When the mind is balanced, then only we can balance the body. That indirectly the Patangasan keep the mind balanced, and also the when the mind is balanced, body is balanced, and when the body is balanced, the hormone is also balanced. The other restorative asanas, that is supported headstand, then supported shoulder stand is there, bound angles pose, head to knee forward bend, then seated forward bend, wide angle pose, garland pose. And then the last one is there, the Viparita Karni. It's good after doing the intercourse. The keep the leg in 90-degree, or on the take the support of the wall, and this is good to keep the sperm inside the body and close the opening of the uterus to. It is good for conceiving, and to keep the sperm inside for longer time for conception. Now we will see the pranayam, the Bhastrika pranayam to remove the toxins. But you should not do the pranayam if the body temperature is more of, or if the menstrual bleeding, menstrual during menstrual period, or if the bleeding is more, then avoid to do the Bhastrika. The Ujjayi pranayam again, it is a good tranquilizing effects it gives, and emotion of good for reduce the stress and emotions, and also it good for the hormonal imbalance. Then Nadi Shuddhi pranayam is increase the vital energy. Also it remove the blockages. Then if any block of any nadi, then it remove, then it good for balancing it, good for removing the stress and make the person calm and quiet. Brahmari pranayam is also to good for removing the stress and anxiety and healing, and soothing effect is there while doing the Brahmari pranayam. And Shitali pranayam or Sitakari pranayam again give the calming effect, cooling effect, and muscular relaxations. Also, it is good for conception. Many time after doing the Shitali pranayam, conception is occur. If there is a more anxiety, then the conception is not there. In anxiety patient, the Shitali pranayam is good. But this pranayam, at least they should do at least 15 to 20 minutes at a time. Then the result is there. Not only doing 5 minutes or 10 minutes. Some cleansing techniques are there. The neti, jal neti is there, rubber neti is there. Jal neti, in jal neti, we are using warm water with salt, and there is a cleansing process of uh, nostrils, and this reduces the stress, which is again helpful for conception. If the stress is more, the conception is not there, infertility occurs. Woman, woman dhoti is also important, which you drink the salty look warm water and vomit it. It reduces the acids which are extra in stomach. Because of increased acid in our body, the irritation is there, anger is there, emotional disturbance is there. Kapalabhati is one of the cleansing process which remove the mental disturbance, release of emotions, and clear the mind. And Agni Sardhavati increase the prana, to increase the pran, and also it increase the tone of the pelvic organs, which are the very important in the case of meditation and mantras. In mantras, Mahamrutyunjay mantra is good for healing and balancing, and it is also good for the threatened abortions. If the frequency of abortion is more, then the Mahamrutyunjay jap is good in that case. Gayatri mantra, it is increasing the pranic energy, you give the vital energy and stabilize this and emotions. It stabilizes the emotions and give energy to that female. Durga mantra is good for fear, to remove the fear. Any kind of fear is there, depression is there. The Durga mantra is very effective. Om chanting, while chanting Om, the vibrations of Omkar, which give the slight massage to the cells, neurons. And then it's also good to reduce the anxiety. Uh, the female become calm and quiet and peaceful of mind is there, which is good for uh, mm, normal endocrine system, to do the normal endocrine system. And Yog Nidra is which is good to for increase the positivity and remove all the negativity. uh, and Antarmon is removing the tension, any type of tension is there, and because of the tension we have seen that the infertility is there. To remove the tension, Antarmon is good. routine and healthy lifestyle is also very important. Means the fixed timing of breakfast, then lunch should be taken at up to 12 o'clock, and dinner you should take at up to 7 o'clock. Again, the timing of work, timing of going to bed, waking up early in the morning is very important in this case. Then fresh air, live in fresh air, then which water they are consuming, then exercise at least 1 hour in each day, and rest at least 6 to 8 hours. The food should be avoided that is high protein and high dairy products. That is, it should be avoid. Then avoid the tea and coffee. Then the processed food, sugar. Take enough quantity of vitamin A and vitamin K also. Vitamin A is beta carotene to prevent the miscarriage. Vitamin K is also important in threatened abortions or habitual abortions. The wheatgrass juice is better. It is very good for prevent the abortions. Then detoxifications, take juices, herbals, supplements, and fasting is also important. But if there is you are trying for conceive, then don't do fasting. Otherwise, fasting or only taking water or lemon and water, or without taking water for at least 1 day, it is also good. Then avoid the contraceptives pills mostly, which disturb the natural cycle or disturb the hormones, any hormonal medicines. Then taking time out for ourselves, yourself, you should take some time. You think about yourself and for conception. Then find the our role in the life, that your lifestyle. But don't think all the time of conception and your menstrual cycle and the date. All the time you are looking on the calendar. That's not good. That increase the stress. Then counseling is also important in this case. Then uh, aromatherapy, herbal therapy, many puncture, acupressure, then like panchakarma, some naturopathy things are there. These are the very important for the arranging for conception. IVF and hormonal treatment or IUI are also the treatment, but we don't say it's 100% give result. Then change the lifestyle and diet and stress. These are the very good therapy. Or if there is a hormonal imbalance, then the yoga therapy is good. Naturopathy yoga therapy is will be give the best result rather than IVF and IUI. Fertility boosting nutrients, beta carotene. Uh, in this, the carrot, then sweet potato, Spanish, apricots. This food you must take. This is good for improve the fertility level in the male, and also it's good for hormonal imbalance. Vitamin B, again, very important to support the ovaries during ovulation. It helps miscarriage. All the vegetables and fruits are there which contain vitamin B, also milk. Then folic acid is very necessary to avoid the nutrial birth defects in babies. In this, the leafy green vegetables are very important. Then vitamin C. Vitamin C you will get from lemon, oranges, sweet lemon, and this help in any if any defect is there in egg or the abortions. In abortion again, vitamin E is also important. If the habitual abortion is there, then give vitamin E content food like almond, then wheat grass, pumpkin, sunflower seeds. Vitamin D helps in improving the infertility in both of them. Then iron deficiency is there, then again it will the problem occur in the ovulation in the female. Omega 3 is again omega 3 fatty acids is very important, which you will get from nuts and seeds, which is good to increase the mobility of the sperm, the quality of the sperm, the quantity of the sperm. It increase also the blood flow in the uterus. If there is a the blood flow is not well, the uterine, then also the problem occurs. The omega 3 is very helpful to for blood circulation of the uterus. Then antioxidant which prevents as well as treat the infertility. Then zinc. The zinc content food is again beans, nuts, and whole grains. This is also good to improve the quality of the sperm. These are the food to eat. The vegetables, the green leafy vegetables are very important. Broccoli, then Brussels sprouts, cabbage, potatoes, tomatoes. These vegetables are good to improve the sperm count, then the mobility, and in the female the uh, quality of the egg, and therefore most of the time you must take the vegetables and fruits more in the infertility cases. And the important vegetables and I have given here, and leafy vegetables is very important. Again, the carrot is very important. Then the fruits, then fruits in fruits the pomegranates, then avocado, banana, berries are also very important uh, in infertility. Maca, a good source of amino acids and glycoside, which helps increase the libido in both the parents. Turmeric is good, is a rich antioxidant, and also it is good in anti-inflammatory, like antiseptic also. If any infection is there, then you must take the turmeric. Then garlic, it is also good to increase the mobility of the sperm, is an antioxidant antioxidant, then helps increase the chances of conception when taken every day before ovulation. Olive oil, improve the fertility in couple who have undergo the IVF treatment. It increases the insulin sensitivity. It is also anti-inflammatory. Pumpkin seeds. The pumpkin seeds is contain the zinc, helps in increasing the testosterone and semen level, and promote the blood flow to the reproductive organs. Also helps in the producing mature egg. It's a rich source of zinc. The pumpkin is a rich source of zinc. Here again, you see some seeds and nuts, that is flax seeds, sunflower seeds, almond, walnuts. These are also very important in infertility. Uh, and you must eat all these things maximum in your diet. You must change your diet and you observe that these things are there in your diet or not. But don't take all these things every day. See, today we are taking almonds and walnuts, then tomorrow you are taking that sunflower seeds. Like this, you should change your diet for to remove the infertility. Also, avoid the food which is high pesticide. Any fruits or any vegetables, the strawberry is there, spinach is there, grapes is there. You must avoid that. If organic food, organic fruit, organic vegetables is there, you must eat. Again, avoid the seafoods which are given here. Then food high in trans fats, that is a fried or processed food which contain preservative also. That food you should not take, which affects the ovulation or the infertility occurs. High intake of carbohydrates is also not good, and low intake, very low intake of carbohydrates is also not good. You should balance the carbohydrates. Don't take the caffeine, then drinking alcohol and smoking is also not good. Avoid. And the soya products is also not good, mostly in the male, because many times it the testosterone level, it reduces the testosterone level. To prevent the miscarriage, avoid any toxic substance like drugs, caffeine, green potatoes, chemicals, then taking regular meat or any hormonal pills, nicotines, heavy metals. Also give the time to the body in between two pregnancy or any abortions is occur. Take 3 to 6 months at least for next conception. Don't take immediate chance for baby. Then take good diet with enough vitamins, all type vitamin A, B, E, K. K is again very important. Vitamin E is important, vitamin D is important, all types of minerals. And for all these things, you should take vegetables and fruits more. Balanced yoga practice and focus on your genital organs and also for conception, because many types of yoga is there, but which is important for removing the infertility, or for the which is yoga, good yoga, that asanas and pranayam and mudra for conception. That yoga you must do. Then only you will get the effect, and you will be get conceive early. Preparation for conception is very important, and it should be start 3 months before, 3 to 6 months before, and both of them, the male and female, both, they should do some yoga, some naturopathy treatments, and all these things they must prepare mentally and physically for conception. The ovulation occurs when the egg is released, uh, mostly the 14th day. It released from the ovary, and it come in the fallopian tube. Then the sperm come within 24 hours. Then the conception is occur, and then that uh, embryo come and attach in the uterus. This procedure take 2 to 3 days, and this is also depend on the hormones. If you are doing the yoga, then mostly the oxytocin is helpful to take that to for conception. It is very helpful, and after the conception in the fallopian tube, they go and attach in the uterus, and this occurs due to oxytocin. Then the time is also very important, uh, and the lady must know the ovulation period. They must observe their body. The body temperature is a little bit increase, some changes in mucus, therefore they must aware. And last thing is the letting go, that for this you must change the weather, go for picnic, or where you want, where you will be fresh, your mind and calm and quiet. Like this changes you must want for the good healthy baby. Hari Om.